Hello, I'm Catherine, Arcadia Physiotherapy, and I'd like to tell you today about my top tip for sitting correctly. So I've got my pelvis in front of me, and this is kind of a general replica of a female pelvis. You'll see my sitting bones correlate with the bony bits at the front here, pubic bone at the front, and at the back you'll see there's the sacrum, bony bit down the back, and the coccyx right at the bottom. You may see at the back of your base of your back there's some little dimples, and that's where these generally reside. So, what's so bad about sitting? So I will sit here in my normal comfortable position, and all I'm doing is just sitting as I normally would, but it's not really optimum for my back. My pelvis, instead of being upright here, has just tilted back. Feels perfectly comfortable to me, but it also means that my shoulders and my middle back are quite rounded. My eyes always want to be horizontal. That's what my brain is telling me, to keep us all level and balance it with our ears. So what that means is if my back is rounded, then I'll have to lift my head up here, which uses the back muscles up here at the base of my neck, and over long hours of computer work and whatnot will cause tension here, potentially headaches, and maybe some pain down the middle of the back. Certainly what's happening down here is not ideal. So if we look at the side of the pelvis, so again there's your bony bits at the front, and here at the bottom are your sitting bones. So if you put your hand underneath your bum, you can feel there's some knobbly bits there, one on either side. So what I ideally want to do is put gravity straight through there, because that's what they're designed for, those sitting bones. If I just tilt my pelvis back to sit on the nice squidgy bit of my bottom, what that does is just tilt back the pelvis a couple of degrees. What that means is gravity is no longer going through the sitting bones designed to do that, but going through more of the sacrum area where people have a lot of low back pain. It also means that the lower back muscles are working in a slightly elongated position, which is not ideal for them. You'd think if you're relaxed in a slouch like this, your muscles aren't working all the time, but they are, because they're connected to the ones further up your neck, which are working obviously to keep you upright. The opposite can also be true. If we tend to sit conscious of our posture, stick our bottom right out and our chest out, that's not really ideal either, because it's working these muscles in their shortest range, which again is not perfect for them, and will affect our posture up top as well. So, in summary, basically it's all about the base. So, if I'm tilting my pelvis backwards, it's putting a strain on my lower back, and if I'm tilting it forwards, much less common, but again it's not really ideal. So if you're worried about your posture, the first thing and the easiest thing to do is to work out, are you sitting on these knobbly bits, your sitting bones? And if you can get that right, then you really have set the scene for better posture up top. Because if I'm on my sitting bones nice and tall like this, actually if I want to slouch, it just feels really odd, because my back wants to relax backwards to compensate for that curve. If I keep my pelvis in a good position, it's just almost impossible to slouch at the top, which will then save my shoulders and neck and keep that position open. So if you get the base right, then you're in a much better position to get the upper back right. So that's my top tip for sitting well. Remember to tilt your pelvis so you're sitting on the sitting bones. And best of luck. My name is Catherine, and I'm from Arcadia Physiotherapy.